Healthcare. Hell. The dangerous reality for American expats in the Philippines. Let me paint you a picture. White sand beaches, water so turquoise it looks photoshopped, palm trees swaying, maybe a hammock. Friendly locals smiling, offering you fresh mangoes or a cold San Miguel beer. The cost of living? A fraction of what you pay back in the States. English is spoken everywhere. It sounds like paradise, right? That's the dream the Philippines sells. And honestly, it delivers on a lot of it. That's the dream that pulled me, and thousands of other American expats halfway across the world. We come seeking adventure, a lower cost of retirement, a simpler way of life, escape from the 9-to-5 grind. And for a while, it feels like we've found it. Until something goes wrong. Until that beautiful, tranquil image shatters in the harsh, fluorescent light of a hospital waiting room. Until you realize that paradise has a hidden, dangerous price tag, and it's written on a medical bill you have to pay. Before they'll even properly treat you. That's when you discover the other side of the coin, the potential healthcare hell that awaits American expats in the Philippines. Don't get me wrong, I love so much about living here. The people are genuinely warm and welcoming. The natural beauty is breathtaking. And yes, your dollar stretches incredibly far compared to back home. When you first arrive, everything seems easy. You find a nice apartment for a price that would barely cover a closet in California. Food is cheap and delicious, and navigating daily life feels manageable because almost everyone speaks some English. You might even visit one of those gleaming modern hospitals in Metro Manila, maybe St. Luke's or Makati Medical Center, for a checkup or a minor issue, and think, wow, this isn't bad at all. It's clean, efficient, the doctors speak perfect English, and it cost way less than my deductible back home. You get lulled into a false sense of security. You think you've got it figured out? Healthcare? Cheap, accessible, no problem. That's the trap. Because that experience, the one you have in a top-tier private hospital in the heart of the capital, is not representative of the healthcare reality for most people in the Philippines, nor is it the reality you'll likely face if you have a serious emergency, especially if you live outside the privileged bubble of Manila's wealthiest districts or Cebu City. The healthcare system here isn't just one system, it's a starkly divided world, and for an expat, navigating it can feel like playing Russian roulette with your health. Let's break down this dangerous reality. First, understand the massive chasm between public and private healthcare. The public system, used by the vast majority of Filipinos, is chronically underfunded, overcrowded, and often lacks basic resources. Imagine ERs with patients lining the hallways, ancient equipment, if any, frequent shortages of medicines and supplies, and sanitation standards that would make a U.S. hospital administrator faint. Doctors and nurses in the public system are often dedicated but work under incredibly challenging conditions. As an American expat, unless you have absolutely no other choice, you will likely avoid the public system entirely. It's simply not equipped or resourced to meet the standards we often take for granted. And the experience can be chaotic and frankly terrifying if you're seriously ill or injured. So expats rely on the whole private system. And yes, at the very top end, in hospitals like St. Luke's, both in Quezon City and Bonifacio Global City, or Makati Med, you can find excellent world-class care with modern technology and highly trained, often U.S.-educated specialists. They actively court medical tourists and wealthy Filipinos. But this top-tier care comes at a significant cost, much higher than other private hospitals in the Philippines, and while maybe less than an uninsured U.S. hospital bill, still substantial. More importantly, this high-quality care is heavily concentrated in Metro Manila, and to a lesser extent, Cebu City. Step outside these major urban centers, and the quality and availability of private healthcare drop precipitously. This is the geographic roulette you play by living in the provinces or on one of the thousands of beautiful islands. Your local hospital might be little more than a small clinic with limited diagnostic capabilities, maybe a basic X-ray if you're lucky. Few, if any, specialists, and unreliable electricity or water. They can handle minor issues, maybe stitch up a cut, but anything serious? Forget about it. What happens if you have a heart attack on a remote beach, or get into a serious motorbike accident on a provincial road? Suddenly, that paradise feels very, very far from help. You need to get to a capable hospital, likely hours away in Manila or Cebu. How do you get there? Local ambulance services, where they exist, are often slow, poorly equipped, and hampered by traffic or bad roads. You might need a boat transfer, then a land transfer. Every minute counts in an emergency, and here, those minutes stretch into agonizing hours. This is where the situation becomes truly dangerous. Being stuck in a local clinic that isn't equipped to handle your condition, while desperately trying to arrange transport to a better facility, is a nightmare scenario many expats fear, and some have tragically experienced. Then there's the issue of inconsistent quality of care. Even within the private system outside the absolute best facilities. While many doctors are competent and caring, standards can vary wildly. You might encounter doctors who are quick to prescribe antibiotics for everything, or order a battery of expensive tests that may not be strictly necessary, sometimes driven by the hospital's profit motive. Communication, despite English proficiency, can sometimes be an issue due to cultural differences. There might be a reluctance to question the doctor or a lack of proactive information sharing. Finding specialists outside the major cities is a challenge. Nursing care can also be hit or miss, and it's very common for hospitals to expect family members, or hired help, to provide much of the basic patient care, feeding, bathing, changing linens, things nurses routinely do in U.S. hospitals. This can be a shock and a significant burden if you're an expat here alone or without a strong support network. Now let's talk about the financial side, what I call the insurance nightmare and the tyranny of upfront costs. First things first, your U.S. Medicare is useless here. Most standard U.S. health insurance plans won't be accepted directly either, or will only cover emergencies with high deductibles and complex reimbursement procedures. You absolutely need comprehensive international health insurance designed for expats, and critically, it must include coverage for the medical evacuation, medevac. I cannot stress this enough. Why is medevac so crucial? Because if you have a truly serious condition that local hospitals cannot handle, your only option might be evacuation to a better-equipped facility in another country, like Singapore, Hong Kong, or even back to the U.S. Medevac flights are incredibly expensive, easily tens of thousands, sometimes hundreds of thousands of dollars. Without insurance covering this, you're trapped. But even with good insurance, dealing with Philippine hospitals financially is stressful. The universal rule here, especially in private facilities, is pay first. Forget flashing your insurance card and paying a copay later. Hospitals routinely demand substantial cash deposits. Before, they will even admit you or begin significant treatment, even in an emergency. We're talking potentially thousands of dollars, often required in cash or via immediate bank transfer. Credit cards might be accepted, but limits can be reached quickly, and sometimes they simply demand cash. Your international insurance usually works on a reimbursement basis. You pay the hospital up front, then submit a mountain of paperwork to your insurance company and wait weeks or months to hopefully get your money back. Imagine having a medical crisis and simultaneously scrambling to find thousands of dollars in cash immediately. It adds an incredible layer of stress to an already terrifying situation. It's a no-pay, no-play system, and they are not flexible. Finding key prescription medications can also be a challenge. While major pharmacies in cities are generally well-stocked, specific brands you rely on from the U.S. might not be available. You'll need to know the generic names and be prepared for potential substitutions. More worryingly, the risk of counterfeit medications is real, especially if you buy from less reputable sources outside major pharmacies. Managing chronic conditions requires careful planning to ensure you always have a reliable supply of your necessary medications and potentially navigating local prescription requirements. And those emergency services, as mentioned, they are often lacking. Dialing the local equivalent of 911 might not yield the rapid, paramedic-level response you'd expect in the U.S. Ambulances can be basic transport vans, not mobile ERs. Response times can be long due to distance, traffic, especially in Manila, or simply a lack of available units. You cannot rely on the same emergency infrastructure you're used to back home. Many expats have the number of a private ambulance service, or a specific hospital's emergency line programmed into their phones. But even that is no guarantee of a swift or effective response, particularly outside the main urban centers. Living with this reality takes an emotional toll. There's a constant low-level hum of anxiety beneath the surface of the tropical dream. What if I get dengue fever really bad? What if I have a stroke? What if my appendix bursts while I'm on a remote island? You learn to be more cautious, perhaps avoiding activities you wouldn't think twice about back home. You scrutinize your international health insurance policy, praying it covers every eventuality. You make sure you always have access to emergency cash. You talk to other expats, sharing information about which doctors to trust, which hospitals to avoid, horror stories whispered over coffee. It changes your perception of the place. That carefree feeling starts to erode, replaced by a sense of vulnerability. Of course, some expats will tell you they've had nothing but positive experiences. Maybe they had a planned surgery at St. Luke's that went perfectly and cost less than in the U.S. Maybe they have a great local doctor for routine care. And PhilHealth, the national insurance program, exists, but its coverage is typically basic and often only covers a portion of the cost in accredited facilities, primarily benefiting Filipinos and permanent residents needing lower-level care. It's rarely sufficient for the comprehensive needs and expectations of an American expat used to different standards. These positive anecdotes are valid, but they often represent the best-case scenario, not the everyday reality, or the potential danger lurking beneath the surface, especially when things go seriously wrong far from the best facilities. So, is the Philippines truly healthcare hell for American expats? Maybe hell is too strong a word for every situation. But it absolutely is a dangerous reality. If you are unprepared, unlucky, or living outside the protective bubble of Manila's or Cebu's best private hospitals. The potential for things to go catastrophically wrong due to lack of access, inconsistent quality, upfront payment demands, and inadequate emergency services is significantly higher than back home. The dream of an idyllic, affordable life in the Philippines is powerful. But if you're considering making the move, you need to go in with your eyes wide open to the healthcare risks. Research obsessively. Understand the limitations of the local system. Know where the nearest capable hospital is and how you would get there in an emergency. Most importantly, invest in the best possible international health insurance you can afford, ensuring it has robust coverage for medical evacuation. Your life could literally depend on it. Don't let the postcard image blind you to the potential dangers lurking just beneath the surface of paradise. What are your thoughts? Have you lived or traveled extensively in the Philippines? Did you have experiences, good or bad, with the healthcare system there? Please share your stories, insights, and any advice you have in the comments below. Let's help each other navigate these realities. If this perspective was helpful or gave you something to think about, please give this video a thumbs up. Share it with anyone considering a move or long-term stay in the Philippines, and be sure to subscribe for more honest conversations about the real challenges and rewards of expat life around the world.